7:39 right now, almost 7:40. Time for infectious disease Dr. Zain Chagla to join us with his weekly COVID check-in. Lots to catch up with this morning, Dr. Chagla. So let's start with an update on the monoclonal antibody clinic, which you run out of St. Joe's Healthcare. Wednesday night, you tweeted that 225 doses of antibodies have been given out, and that's pretty remarkable. And tell us how it's helped people.
Yeah, absolutely. I mean, a big praise to the team that has supported this. There's been, particularly three nurses, Joy, Carling, and Amanda, who have really just made this their mission to make sure the right people get treated. And it's been incredible. We've given out more doses than some provinces in Canada at St. Joe's, and we continue to be getting patients. We've had a lot of referrals, obviously, with Omicron, and tried to reach the highest risk people. We've had great outcomes, and people that, even if they were vaccinated, but their immune systems are so compromised that they couldn't make a great response, are still getting incredible outcomes. They're getting COVID and recovering at home, and they're largely doing well. So it's been a great success. There's going to be clinics, I think, using our model across the province to make sure that other people across the province have access to this drug. But yeah, it's been remarkable what it's done to people. And I hope this is something that continues along as we learn to live with this virus.
Well, congratulations to you and the team. And for people who are unfamiliar, these antibodies gives your body kind of a boost against, and I don't mean boost as in booster, but just that added protection against the virus.
Yeah, absolutely. And people at very high risk of hospitalization, so those who are immunocompromised, those who are under-vaccinated, we can reduce the risk of their chance of landing in hospital by about 80% by giving a single dose of this medication.
Lots of social media activity involving boosters for children. Do you think they're necessary yet? And do you know if they're coming soon?
Yeah, the US FDA did approve 12 to 17-year-old boosters. I think it goes back to what we are trying to achieve with boosters and recognizing that 2 doses in a 12 to 17-year-old, remarkably reduces their risk of hospitalization. Likely those who are 12 to 17 who don't have immune system issues or major vulnerabilities that put them at high risk of hospitalization may not benefit significantly from a booster. There may be some transmission blocking in the community, but Omicron as it is does escape vaccines, so it may not be as profound as we would like. And so, I think encouraging 2 doses in these populations is good. Similarly for our 5 to 11-year-olds, encouraging 2 doses. But I think, organizations like the World Health Organization are really pushing back and saying, what are we trying to achieve? Should we be first making sure that, again, the right people have access to first and second doses for their ability to save lives as compared to third doses to just, optimize immunity and reduce the risk from 95 to 96%.
It's that global impact. Now, I want to get your opinion, just you personally. Do you think this is the right time for the province to be lessening restrictions?
Yeah, it's incredibly complex. I think there are a lot of factors at play here, right? Number one, I'm not as certain that restaurants, bars, gyms, and movie theaters were the sole reason for spread in our communities. There's certainly pieces that can be controlled in order to reduce spread. But we know spread happens in workplaces, it happens in homes, it happens in other gatherings. And so, I think we recognize that fact that those industries have largely been punished when things have gone up and down. But at the same time, there are healthcare capacity issues, and we can't have not started surgery. And that is a problem. It's hard to reconcile that restaurants, bars, gyms, and movie theaters have to deal with the burden of what's happening in our hospital, right? And they really do seem connected, even though that connection isn't as clear in that sense.
All right. Dr. Zain Chagla, we have run out of time, but thank you again for your weekly check-in. We really appreciate it.
No problem. All the best.